Welcome to Planet Lasik by Center for Sight. I am Dr. Ritika Sachdev. We're going to talk to you about eye floaters. Do you have a high minus power? Do you know that increases your risk for floaters? A high minus power or high myopia does not just give you glasses. It comes with associated retinal changes. We must understand that high minus power comes because the eyeball is often longer. A stretched eyeball is accompanied with retinal degeneration and vitreous degeneration. Now, these terms may sound complex, but let's understand them further. The retina is the film of the eye which coats the inner lining of the eye. As the eyeball gets stretched, you may have areas of retinal thinning. You also have a jelly that fills the eye between the lens and the retina. This jelly-like structure is called the vitreous. As the eyeball elongates, sometimes this vitreous decompensates or develops small jelly-like degenerations. This is what we call vitreous degeneration. Now, what will happen when you have small little blobs floating in the jelly of the eye? These will cast a shadow in your vision. These small shadows appear to be floating across your field of vision. Tiny black spots, sometimes one or two, and sometimes a large shower of black spots, may disturb your vision. This is what we call floaters. We will now understand the symptoms and signs and the treatment for floaters. The symptoms: you notice a black spot. When does this come in? It often comes in when you're looking at a blank background, looking across the blue sky or at a plain wall. It usually doesn't come in when you're looking at a cluttered background. What do you do? If there is a sudden onset of floaters, they increase in number, you see a large floater, you must undergo a retinal examination. Why is that done? That is done because whenever the vitreous has degenerated, it tends to collapse. And in the process of collapsing, it may pull on the retina. A pull on the retina, which is already thin in certain areas because you may be a myope, can put you at risk for a retinal tear. A retinal tear must be treated before it can lead to more dangerous complications like a retinal detachment. So a floater is really a sign, if it is of recent onset, that your retina may be being pulled and therefore you need to get a retinal examination. What happens after retinal examination? Well, fortunately, most vitreous floaters don't really lead to retinal tears, but you still have to deal with the floater. The answer to that is learn to ignore it. Our brain is a marvelous organ, and we learn to ignore what we don't need. So this floater, which is actually something that's really just disturbing us and not adding value, if we focus on it, we continue to, travel across it. We continue to trace it, much like playing a game. But then we reinforce to the brain that this is useful to us. What you have to do is learn to ignore it. When you stop focusing on the floater, the brain stops to see it. The vitreous may still have these tiny blobs, but they will no longer be as visible, as you will learn to ignore it. Most floaters do not disturb your life. They are just little signs that you have an eye which is myopic, more likely to have vitreous degeneration, and a vitreous degeneration can lead to a retinal tear. Once checked and the retina being normal, learn to ignore your floaters, but be aware that you are a myope or a minus power individual and your retina does need frequent assessments. Important points to know if you have floaters. First, floaters themselves may not be a risk, but they may point to a risk of retinal tear. It is important to get your retina checked. Second, floaters do reduce over time if you learn to ignore them. Third, eyeglasses or LASIK does not cure floaters. If you get eyeglasses, contact lenses or LASIK procedures, your floaters will not go away because they belong to the inside part of the eye. and a simple optical correction does not cure floaters.
Follow Planet Lasik and post your queries to get answers from the experts.